Do you have athlete's foot, which causes symptoms of itchiness, burning, peeling, or an odor on your feet? Do you have a yeast infection on your skin? Do you have candida in your gut, which is causing digestive issues? Do you or your child have creamy white lesions on your tongue, inner cheeks, the roof of your mouth, or your gums, which is called thrush? If you answered yes to any of these, then you might need a prescription for an antifungal medication, such as Nystatin. Nystatin also goes by mycostatin, nadostine, and Nystatin.
Nystatin suspension is used to treat fungal infections of the mouth. It is an antifungal that works by stopping the growth of fungus. Nystatin suspension should not be used to treat fungal infections of the blood. Shake well before using and use the provided medication dropper to carefully measure out the dose. Unless your doctor instructs you otherwise, use as followed. Place half of the dose in one side of the mouth, swish it around, gargle, and swallow or spit out as directed. Keep the liquid in your mouth for as long as possible. Then repeat with the remaining half of the dose in the other side of the mouth. Avoid eating for 5 to 10 minutes after using this medication. Nystatin cream is used to treat fungal skin infections. Use this medication on the skin only. Clean and thoroughly dry the area to be treated. Apply this medication to the affected skin usually twice a day or as directed by your doctor. Dosage and length of treatment depends on the type of infection being treated. Do not apply this more often than prescribed. Apply enough medication to cover the affected area and some of the surrounding skin. After applying this medication, wash your hands unless you are using this medication to treat your hands. Do not wrap, cover, or bandage the area unless directed to do so by your doctor. If used in the diaper area on an infant, do not use tight-fitting diapers or plastic pants. Do not apply this medication in the eyes, nose, mouth, or vagina. Using Nystatin to treat any other type of fungal infections other than candida infections or to prevent any type of infection would be considered to be an off-label use.
Nystatin drug interactions. There are no serious drug interactions with Nystatin. The only drugs that interact with Nystatin are econazole, ketoconazole, mycoconazole, oxyconazole, seretaconazole, and sulconazole, which are all antifungals that have a moderate interaction with Nystatin. The combination of these antifungals and Nystatin represent duplication of therapy whenever these drugs are used by similar routes and are usually avoided. You should tell your doctor about all prescriptions, non-prescriptions, illegal, recreational, herbal, nutritional, or dietary drugs you are taking while on Nystatin. Unless your doctor instructs you otherwise, there are no restrictions on food, beverages, or activities while you are taking Nystatin.
One indication of use for Nystatin is oral thrush. Oral thrush symptoms include white patches on the tongue or cheek like plaques that can be wiped off leaving red marks, loss of taste or an unpleasant taste, bad breath, dryness, redness in the mouth and throat, cracks at the corners of the mouth, and painful when swallowing. Also, a burning sensation has been reported before.
The side effects for Nystatin include the GI system and the integumentary system. For the GI system, it involves nausea, vomiting, anorexia, diarrhea, cramps, and for the integumentary system, it involves rash and urticaria. Urticaria, however, is rare. It can also involve Stevens-Johnson syndrome.
Nystatin is contraindicated in patients with a history of hypersensitivity to any of its components, most notably patients with paraben hypersensitivity. Parabens are a class of preservatives used in pharmaceutical products such as Nystatin, oral suspensions, and topical creams, which contain methylparaben and propylparaben. Other precautions include patients that are pregnant or breastfeeding and patients with diabetes mellitus.
Some patient teaching for the medication Nystatin are that long-term therapy may be needed to clear the infection and patients need to make sure to complete the entire course of medication. Avoid mouthwashes for mouth infections as they can interfere with the medication. Make sure to shake the suspension before each dose. If using topical nystatin, make sure to clean and dry skin before application and avoid covering the treated skin. Notify the prescriber if irritation occurs, as the product may need to be discontinued.